Hello, and welcome to PCLP's Faculty Advisor Orientation. Our orientation program has two components, this video presentation and a live conference call to be held on Monday, April 4th at 3 p.m. Eastern Time. The objectives of this orientation video are, first, to provide a general overview of the PCLP program, including its mission, goals, and objectives for faculty advising. Second, we'll review faculty advisor roles, responsibilities, and timelines. This information is also provided in the Faculty Advisor Handbook you received via email. In our April 4th orientation conference call, both new and returning faculty advisors will meet to discuss advising issues that can be addressed more effectively in conversation. Members of the PCLP Faculty Advisory Committee will lead that discussion and answer your questions about the advising experience. In 2012, the GE Foundation partnered with National Medical Fellowships to address both the primary care shortage and inequities in the healthcare system, which include not only disparities in health outcomes, but also the underrepresentation of minorities and lower-income students in medicine and in graduate nursing and physician assistant programs. The mission of PCLP is to address the primary care shortage and healthcare system inequities simultaneously by placing underrepresented students at community health centers nationwide for primary care service learning experiences. Scholars gain valuable experience as part of primary care delivery teams for the medically underserved. This nurtures for many their passion to give back to communities in need. PCLP thus pursues, in one single step, two mutually reinforcing components of our mission: building capacity at community health centers and developing the pipeline of future primary care practitioners. And it's working. To date, PCLP scholars have contributed more than 51,000 service hours and 256 capacity-building service learning projects at our partner CHCs. And 83% of scholars who have graduated from their academic programs have entered primary care practice or chosen primary care as their specialty. We attribute PCLP's success to our ability to accomplish four goals in partnership with PCLP faculty advisors and other stakeholders: inspiring scholars to serve the medically underserved by giving them the experience of serving in those communities, providing an engaging primary care leadership training program and cultivating scholar skills in data-driven project management via the team-based PCLP project, enhancing scholars' clinical skills through clinical rotations, and building a national network of mentoring support for scholars by introducing them to CHC providers, university faculty, and other healthcare leaders. Here's where the PCLP network exists this year. We're placing 55 medical scholars and 5 graduate nursing scholars in 11 cities coast to coast. The Faculty Advisor Handbook has a complete listing of PCLP cities, along with our site partners, faculty advisors, and scholars in each city. Within the PCLP program, PCLP faculty advising is a strategic initiative to secure the academic rigor of PCLP programs and projects. Our specific objectives here are to provide academic guidance for scholars' data-driven projects, to strengthen relationships between community health centers and university faculty in primary care and community health for the benefit of health profession students, to provide academic and professional mentoring to scholars. In 6 weeks, important bonds can be forged and insights gained that benefit scholars for years to come. And because faculty are on the front lines with students on their campuses, they're valuable sources of student referrals to PCLP. Each year, we also invite a few faculty advisors to review new scholar applications. Faculty advisors often seek clarification of the division of labor among those involved in mentoring and supporting PCLP scholars. PCLP staff handle all administrative aspects of the program and are here to support all stakeholders throughout the program season. We also conduct the leadership training course and host program events such as the PCLP Symposium to be held in July. PCLP site supervisors are the scholars' primary supervisors as they supervise and monitor scholars' daily activities on site. Site supervisors also determine the PCLP projects to be conducted at their sites. Again, PCLP faculty advisors bring valuable academic support to PCLP by supporting sites in scoping out feasible team-based PCLP projects, serving as scholars' project advisors, and providing professional and academic mentoring to scholars. Now, let's look at the faculty advisor role more closely. Here are requirements for all faculty advisors. Before scholars arrive, advisors assist sites in scoping feasible projects, make first contact with scholars, and participate in faculty advisor orientation. During Scholars On-Site period, the first task of advisors is to review and approve Scholars project proposals. Their proposal form, which you can find in the Advisor Handbook, is similar to the project scoping form you complete with site supervisors, but it allows scholars to specify their activities and timelines in more detail. From then on, you will meet with your scholars once each week via phone or email or in person to monitor their progress. In a moment, I'll discuss what your focus might be for each weekly meeting. To assist you in staying on track and to keep PCLP staff apprised of scholars' progress, we will ask you to complete very brief status reports at the end of weeks 2 and 4. We'll send you a link to a survey that should take no more than 10 minutes to complete. You can find the status report questions in the appendix of the Advisor Handbook. Here's a sketch of a meeting plan from pre-arrival through week 6 of the scholars' time on site. In April and May, it would be great to introduce yourself to your scholars and learn something about them, including what PCLP projects interest them and why. They'll receive project information in May after we collect project scoping forms from sites and faculty advisors. In week 1, you should meet with scholars, ideally in person, to review and approve their project proposals. Their proposals are due at the end of week 1. The focus of weeks 2 through 4 should be project progress. Have projects launched successfully? Are data collection and other activities progressing on schedule? Are your scholars skilled in data analysis, or do they need your guidance? In weeks 5 and 6, your meeting should focus on your scholars' presentations to sites and their plans for writing up the PCLP report. The reports are due 2 weeks after their placement period ends. Of course, you may find it prudent to discuss topics at different points on the timeline. That's perfectly fine. This is just a guide. After your advising period ends, there are a few more activities. PCLP program evaluation begins in August. All faculty advisors must complete the evaluation survey. You may also be invited for an interview to discuss your PCLP advising experience. Again, because you are on the front lines with health profession students, we appreciate your support of our fall recruitment effort by sharing PCLP information and referring great students to us. Please also let us know if you would like to participate in the review and selection process. Here's a timeline of faculty advisor activities. 3 additional items are worth noting. On May 31st, PCLP will host our annual kickoff, which launches our season with reflections on our mission and the importance of primary care leadership. Featured speakers include National Advisory Committee members, including our chair, Dr. Jack Geiger. Secondly, we'll bring all 60 scholars together for our first annual PCLP Symposium to be held July 10th and 11th in Chicago. Our purpose? To inspire, amplify, educate, and celebrate. Sessions will focus on primary care leadership and professional skill development, and a select number of scholars will be invited to present their PCLP projects before a distinguished reactor panel in a special session. Throughout the symposium, scholars will network with a range of primary care leaders, PCLP stakeholders, and National Medical Fellowships alumni. Finally, advisors' honorarium payments are dispersed after advisors complete their program evaluation surveys. Survey completion is required for disbursement. Payment procedures are outlined in the Advisor Handbook. Before we end, we'd like to share what our scholars report as being the qualities of advisors most conducive to their success. Conversely, when these qualities are missing, scholars report dissatisfaction with their experience. The most frequently cited quality is availability or accessibility. Scholars greatly value advisors' commitment to their weekly meetings and their prompt responses to calls and emails. Scholars also value the knowledge you share with them, especially about your profession, your leadership experiences, and important issues in primary care. Not surprisingly, scholars also express appreciation of your supportiveness, your attentiveness to their interests and insights. Finally, we want to remind you of resources at your disposal. The Faculty Advisor Handbook provides comprehensive information about the faculty advising program. The PCLP website provides additional helpful resources, including a resource library of past ISL projects. PCLP staff are also resources for you at any time. They are happy to answer your questions or discuss your concerns related to faculty advising. As always, the GE Foundation and National Medical Fellowships thank you for your commitment to mentoring these outstanding future primary care leaders. We look forward to speaking with you on the Faculty Advisor Orientation Conference Call and to working with you this summer.